How air ambulances work. Air ambulances are specially equipped aircraft used to transport critically ill or injured patients quickly and safely to medical facilities. They are essentially flying intensive care units with advanced medical equipment and trained medical personnel on board. Here's a brief overview of how they work. Activation. When a patient needs urgent medical transport, an air ambulance service is contacted. This can be initiated by hospitals, emergency services, or individuals. Assessment. Medical professionals assess the patient's condition to determine the urgency and type of air ambulance required. Preparation. The aircraft is prepared with the necessary medical equipment and supplies. The medical team, including doctors, nurses, and paramedics, is briefed on the patient's condition. Transport. The patient is transported to the aircraft, often from a hospital or accident site. During the flight, the medical team provides continuous care. Handover. Upon arrival at the destination, the patient is transferred to a ground ambulance or directly to the receiving medical facility. Types of air ambulances. There are several types of air ambulances, each suited for different scenarios. 1. Helicopter Emergency Medical Services, or HEMS, ideal for short distances and reaching remote or congested urban areas quickly. 2. Fixed-wing air ambulances, used for long-distance transfers, often between cities or countries. These aircraft provide a stable environment for extended journeys. Commercial aircraft medical escorts. Medical personnel accompany patients on commercial flights, providing care during the journey. Rotary wing critical care transport, similar to HEMS, but equipped for more critical care scenarios. Air ambulance pods, specialized pods that can be fitted into various aircraft for patient transport. Jet air ambulances, high-speed jets used for long-distance and international medical evacuations. The cost of air ambulance services in India varies based on several factors, including the type of aircraft, distance, medical equipment required, and the patient's condition. Here are some general cost estimates. Helicopter transfers, INR 1 lakh to INR 10 lakhs, which is approximately $1,350 to $13,500. Fixed-wing aircraft transfers, INR 2 lakhs to INR 50 lakhs, or roughly $2,700 to $67,500. The average cost typically ranges from INR 4 lakhs to INR 10 lakhs or more. The cost of transporting a patient from Delhi to Mumbai by air ambulance can vary based on several factors, including the type of aircraft, medical equipment required, and the patient's condition. Generally, the cost ranges from INR 6.5 lakhs to INR 8.5 lakhs, which is approximately $8,800 to $11,500. You can contact several air ambulance services in India. Here are a few options. Air rescuers. You can reach them at phone number +91 987 000 1118. They also have a toll-free number 1-800-267-0170. For more details, visit their website at airrescuers.in/contact-us. Medilift Air Ambulance Services. Their contact number is 07367020595. You can find them at Krishna College Road, Visakhapatnam, Andhra Pradesh 530013. For more information, check out their website at medilift.in. ICAT Air Ambulance. You can call them at +91 970 111156. Their website is icat.in/international-air-ambulance-services. These services are available 24/7 and can assist with both domestic and international medical transfers. Insurance coverage for air ambulance services can vary depending on the policy and provider. Here are some key points to consider. What air ambulance insurance typically covers? 1. Medical care during transport. This includes necessary medical treatments such as oxygen, life support, and other critical care services provided during the flight. 2. Bedside-to-bedside service. Some policies cover the cost of transportation to and from the aircraft, ensuring continuous care from the initial location to the destination. 3. Emergency situations. Many health insurance policies cover air ambulance services in emergency situations where rapid transport is medically necessary. Factors affecting coverage include several key aspects. First, let's talk about the insurance provider. Different providers have varying levels of coverage, so it's important to check with your specific insurer to understand what is included. Then we have policy details. The extent of coverage can depend on the specifics of your health insurance policy. Some policies may have limitations or exclusions. Another crucial factor is in-network versus out-of-network services. The No Surprises Act in the United States requires that air ambulance services be billed at in-network rates for emergencies, even if the provider is out of network. Similar regulations may apply in other countries, but it's best to confirm with your insurer. And finally, out-of-pocket costs. Despite insurance coverage, there may still be out-of-pocket costs. These can include deductibles, co-pays, or any amounts not covered by the insurance policy. It's advisable to discuss these potential costs with your insurance provider beforehand. Steps to ensure coverage include a few important actions. First, review your policy. Understand the specifics of your health insurance policy regarding air ambulance services. Next, contact your insurer. Speak with your insurance provider to clarify what is covered and any potential out-of-pocket expenses. Lastly, consider emergency assistance plans. These plans specifically cover air ambulance services for added peace of mind. The cost to set up or provide air ambulances involves significant investment in aircraft, medical equipment, and personnel. The costs can vary widely based on the type of aircraft and the level of medical care provided. Here are some rough estimates. For a helicopter air ambulance, the cost of purchasing and outfitting a helicopter can range from INR 10 crores to INR 30 crores, which is approximately $1.35 million to $4 million. For a fixed-wing air ambulance, setting up can cost between INR 20 crores to INR 50 crores, approximately $2.7 million to $6.75 million. These figures can vary based on specific requirements and the scale of operations. I hope this information has been useful to you.